So some of the biggest challenges affecting nurses in Australia, I guess from my perspective, and you need to remember that I work in the general practice and primary healthcare setting, so I think our challenges might be different from the hospital setting, but I can answer from our perspective certainly. So I think the majority of the issues stem from our funding model at the moment. So it's very prohibitive for nursing. It's a fee-for-service model where the GPs bill for the services that they provide, and obviously that limits the nurses' direct commercial value because only GPs can bill to Medicare. So it's just a matter of how do we navigate the funding model as it stands and advocate for perhaps a better funding model, which certainly the government is exploring at the moment in a capitated or fee-per-patient model, which I think would really help the nursing workforce and create more opportunity for us. We are investing in our workforce as we anticipate changes to the funding model, and that involves expanding their scope of practice. So looking at, it's general practice, so the key word there is general. There is no specific scope of practice that we can adhere to in general practice, so it's a matter of getting nurses working to their full capacity and within their full scope of practice across a wide spectrum. So we're really supporting that through education. We're adding headcount. We're giving more roster hours. We've hired medical assistants to help with some of the administrative tasks. So it's just really freeing up the nurses to do what they do best and give direct patient care and more of it. I think nurses are really good at kind of tying things all together. We kind of sit at the center and we coordinate all of the services and kind of help the patient along that journey. So having a happy and strong nursing workforce is good for business and good for patients as well. From a Healius perspective, having nurses kind of drive our vision because they are our employees and the GPs are not our employees. So we can drive our vision through the nursing team, and we know that if we have a strong nursing workforce, they will be best equipped to, kind of take our initiatives and run with them well. Well, I think it's just been a nice eye-opener at, there's a lot of exciting things going on in healthcare at the moment, and I think sometimes it's just a matter of getting out of your environment and, kind of getting out of your workspace for a day or two to just have a look around and see all of the exciting things going on. And it's quite inspiring, frankly, because, it kind of gives you ideas of how you can implement different ideas into your own workplace and your own practice.